All right, welcome to All Things Gut. So, for those of you that don't know me, I am Tammy Conacher. I am a registered nurse of 28 years. I battled Lyme disease for 9 years, and I am a survivor now of 2 years. So, I have done everything I can to research the gut and how the gut really affects overall health, and actually how the Plexus products, which are some of the topics I'm going to go over today, actually help to repopulate the gut bacteria. So we're going to start with some basics. Blood sugar stabilization and prebiotics are critical. They're critical in your arsenal of defense. If your gut microbiome is not populated with the right gut bacteria, disease states will set in. So we call this dysbiosis. Dysbiosis is a bacterial imbalance in the gut. So when that balance is disrupted by antibiotic use, steroid use, our poor diets. The standard American diet is a very poor diet. Even though the guidelines are there, it is actually a very, very poor diet. So that disrupts your gut microbiome. So you have to have the right amount of gut bacteria. Gut bacteria is what breaks down our foods. So if we don't have that right amount of gut bacteria, our foods are not digested and we're not absorbing the enzymes and vitamins that we need from our food. So we are going to go over today Slim. I want to talk to you a lot about Slim, the ingredients in Slim. I'm going to break them down for you so that you understand why this works and the science behind why it works. I do a lot of research now on the gut, the biome, and I've taken each of the ingredients from the Slim and I broke them down and done intensive research from, I do a lot of mine from the National Centers of Research. So it's the National NCBI and medical review journals. So a lot of this information comes from medical review journals, not from Plexus worldwide. So we're going to talk first about alpha lipoic acid. Alpha lipoic acid is a key component in one of our Plexus drinks. It's called Plexus Slim. Yes, I don't like the name of it. Most of us do not like the name of it. When Plexus first came out with this product, they actually designed this product for diabetics. But what they found was people were more apt to spend money on their weight than they were for their diabetes. So they called it Slim. Unfortunately, I don't like that term because I have a lot of irritable bowel patients, celiac patients, Crohn's disease patients that are underweight that actually can gain weight with this product. When you get that gut biome back in a biosis state, not a dysbiosis, but a biosis state, then your body actually will put on the weight or get rid of the weight that it needs to. So alpha lipoic acid is a key mitochondrial compound. Mitochondria, for those of you who remember your science studies, mitochondria are our powerhouse cells. They're the ones that do all the work. So they're used to break down carbohydrates and to make energy for our body and for the organs in our body. Alpha lipoic acid is a powerful antioxidant, which means it helps to provide protection for the brain and the liver. It improves the conduction and function of neurons in diabetes, helps with diabetic neuropathy. It reduces inflammation in the body by decreasing the inflammatory markers such as C-reactive protein, which is CRP. A lot of you have seen that on your lab work. CRP, that's C-reactive protein. It's an inflammatory marker. And IL-6, which is interleukin, and TNF, which is tumor necrosis factor alpha. It is increased chronic inflammation is associated with increased risk of metabolic disorders, including type 2 diabetes, atherosclerosis, endothelial dysfunction, vascular calcification, increased activity of oxidative damage, and degeneration of collagen in our body. I don't know if you know, but as you age, collagen decreases in our bodies. So that's our skin elasticity. You'll notice the wrinkles starting. That's the degeneration of collagen in your body. It also slows the disease progression in MS, which I really like this. Pilot studies showed that consuming alpha lipoic acid daily reduced the whole brain atrophy among patients with progressive multiple sclerosis. According to the neuroimmunology and neuroinflammation of the Oregon Health and Science University of School of Medicine, Dr. Rebecca Spain, she did studies in those patients that were given ALA, alpha lipoic acid, daily, showed a 68% reduction in their rate of whole brain atrophy. Conservatively, those that were taking Ocrevus, which is a normal drug that we give for MS patients. And I did MS teaching. I did home health, so I did a lot of the MS teaching for patients, how to give their injections, what MS does to the body. For those of you that don't know, if you think of a wire, a telephone wire, and it's got the coating so that it transmits, well, what happens with MS is that myelin sheath, which is the coating, starts to break down. So it gets little chunks out of it. So when the conduction goes through, it is slowed because it's not being able to go past that junction. So you'll see the weakness. All those that come up and down, like they'll do good for a while, then they do bad for a while. So it's called flares. So they actually saw a 68% reduction in the rate of whole brain atrophy with the alpha lipoic acid versus Ocrevus. The improved whole brain atrophy was 18%. So studies show quite a bit, almost 50% increase by taking alpha lipoic acid versus Ocrevus for MS. Alpha lipoic acid has been shown to increase lactobacillus by 365 times and bifidobacterium by 290 times. We're going to go into those, so don't panic. Okay, bifidobacterium and lactobacillus, they're the crucial components to our gut microbiota. They're the gut flora in our body. The evidence suggests that these probiotics can alleviate lactose intolerance. They can inhibit the growth of harmful bacteria. They can prevent colon cancer. They can decrease cholesterol levels, which we've seen a lot. We've gotten a lot of doctors, a lot of nurse practitioners calling me saying, hey, what do you got these people on? Their cholesterol levels are dropping over 100 points. That's the alpha lipoic acid working. It improves digestion, reduces inflammation, and stimulates the immune system. Okay, now we're going to talk about the xylosaccharides. The xylosaccharides is another ingredient in Slim. It's the XOS. If you see XOS on the Slim, that's your xylosaccharides. They are prebiotic fiber. They selectively feed the beneficial bacteria. So the XOS feeds the lactobacillus and the bifidobacterium. So having that XOS builds up the lactobacillus and the bifidobacterium so that our immune system is stronger. Research shows that 6 weeks of daily ingestion of XOS induced significant increase in fecal bacteria counts of lactobacillus and bifidobacterium, as well as it decreased Clostridium perfringens, the most common bacteria causing food poisoning, Salmonella, and Staph aureus. So we have an overabundance of Staph aureus. I've done hospital medicine for 27 years, 20 of my 27 years as a travel nurse. That 27 years, my whole career has been in the hospital setting or hospice setting. So we've seen a lot of staph increase over the past few years. And I really do believe it's due to the lack of our biome, our gut biome, being broke down by environmental issues, antibiotic overuse, steroid overuse in America. So I just wanted you to know that the XOS, which is the xylosaccharides, are now on the leading forefront of medicine and medical research. Dysbiosis, or the imbalanced microbiota, are linked to disease states such as irritable bowel syndrome, type 2 diabetes, obesity, those type of things. So when your gut bacteria is broke down, we think about the cholesterol levels. They're going high, so we're leading to heart disease. We're leading to diabetes. We're leading to irritable bowel syndrome. We're getting leaky gut syndrome. And kind of in essence, if you think of leaky gut syndrome, probably the best way to discuss leaky gut syndrome is there's junctions in the colon. So in those junctions, what happens is there's actually spacing as you do not have enough good bacteria. So what happens then is bacteria is leaked through, or proteins are leaked through the intestinal wall. Proteins in their direct form are actually inflammatory to the body. Our bacteria is there to break down proteins so that we can use them and utilize them to the best of our body's ability. But if we do not have that good gut wall to do that and the good gut bacteria, then we can see some inflammation occur from consuming proteins. What does the lactobacillus do for the body? It is the major part of the lactic acid bacteria group, converting sugar to lactic acid. So it produces hydrogen peroxide, which inhibits the growth of virulence and of fungal pathogens in the body. Lactobacillus is also associated with a reduction of atopic dermatitis. So if you have somebody with chronic skin conditions, the probiotic, the XOS, is really important to feed that lactobacillus. And the alpha lipoic acid actually feeds that lactobacillus too. So replacing those will help with atopic dermatitis. Next, we're going to talk about the green coffee bean extract found in Slim. A lot of people panic and go, it's got caffeine. It has a minute amount of caffeine. Green coffee beans are actually the unroasted coffee bean. So when we're talking about green coffee bean, we're talking about the extract of that green coffee bean. The key component that we're seeing with this that helps is the chlorogenic acid. Research shows that the chlorogenic acid boosts metabolism by 3 to 11%, which reduces fat absorption from the diet. It reduces fat stores in the liver. So fatty liver disease, we start to see a decline in fatty liver disease. I've had multiple people that have been diagnosed with fatty liver disease that now have been considered free of their fatty liver disease. With Lyme disease, my liver enzymes were elevated for the full 9 years that I was struggling with my Lyme disease. They are now within normal levels and have been for the past 2 years. And I attribute that a lot to the Slim, the alpha lipoic acid, and the cholinergic acid from the green coffee bean extract. So cholinergic acid appears to reduce glucose absorption, thereby playing a protective role in diabetes management. Chlorogenic acid has been shown to lower blood pressure, thereby benefiting heart disease. The first thing I do when I start somebody on my Slim products or Balance is I tell them, I want you to take your blood sugars. And I want you to be checking your blood pressure. Most of those people are already on diabetic medications. They're already on antihypertensive medicines. So as our body, their good bacteria gets colonized, then their diabetes will start to come down into check, and their blood pressure will too. But what happens is that they're taking both, if they're taking the Slim and their medications, we could actually cause too much of a drop. So when I start somebody, I said, please monitor your sugars for me, monitor your blood pressures. As soon as you start to see some drops, we need to let your physician know that that's starting to go down so that we can adjust medications accordingly. So, and next we're going to go into the chromium. Chromium is an essential element. It's involved in the regulation of blood glucose levels within the body. It acts as a binding substance to amplify the action of natural occurring insulin in the body. So the moment you eat, the moment you put something in your mouth, your pancreas is triggered to say, hey, I need to secrete some insulin. I got to break down this sugar. So that acts as a binding substance to help to amplify that action of the body so the pancreas can do its better job at a better rate. It's shown to reduce insulin resistance and to help reduce the risk of cardiovascular disease and type 2 diabetes. Chromium levels decrease as we get older. So that's why you're starting to see, as we get older, we start to have more problems with diabetes, hypertension, triglycerides, all those things, is because that chromium level decreases as we get older. So chromium is an essential element that appears to be beneficial in the regulation of insulin actions and its effects of carbohydrate, protein, and lipid metabolism. Without it, we start to see the diabetes, the cholesterol issues, and hypertension. Insulin resistance affects 40% of people in their 60s and 70s with or without metabolic disease. So with or without diabetes, we start to see some insulin resistance, which starts to set up the disease states. Insulin resistance is present in 2 serious health conditions, which is very common. We're starting to see a lot more of it is polycystic ovary disease, or PCOS, and gestational diabetes. So what's the difference between the XOS and HC? So we have 2 forms. We have the microbiome activating, or XOS Slim, and we have the HC Slim, which is the hunger control Slim. So the major component that is different is with the hunger control Slim, it has polydextrose added to it. Polydextrose is a plant-based polysaccharide. It's derived from non-GMO cornstarch. Unlike the starch though, however, the carbohydrate and polydextrose are uniquely linked together. making them resistant to our digestive enzymes, which is important for anybody with Crohn's disease, colitis, diverticulitis, irritable bowel syndrome. They have huge absorption issues. So they need that soluble fiber. Soluble fiber is that provides partial fermentation throughout the colon by decreasing the colonic transfer time. So it means it's slowing it down. Because those people have such a problem absorbing, this actually slows down the time that everything's moving through their system, so they can actually absorb nutrients from their foods. The great sources of soluble fiber for GI disease, because it's complex structure. PDX, or polydextrose, is not hydroxylized by the digestive enzymes in the small intestine. It's passing intact into the colon, which is gradually and partially fermented by the microbiome for use for energy. Research has shown an increase in the acute retention of calcium by 102%, and the increase in the acute retention of magnesium by 56%. If you look at our population today, most of us are magnesium deficient. And I tell you to be very cautious when you're looking at labs for magnesium. When we do a serum magnesium, your magnesium is mostly contained in your blood, your brain, bone, and heart. So when we're looking at a serum magnesium level, we're actually not getting a true source of how much magnesium your body's containing. So, but with the polydextrose, they're showing that there's an acute retention by magnesium of 56% and the calcium by 102%. So you start to think about osteoporosis, and women in their older, as they get into menopause, losing their calcium. The polydextrose will help with actually retaining that calcium that their body needs. So I hope this has helped. I like to try to get into the scientific. I've done medicine for so long that I think people look at a company maybe such as this, which is a multi-level marketing company, and they want to poo-hoo it because of the company, of a multi-level. But yet when you get into some quality products and you get into quality ingredients and quality research, it's something that really needs to be taken into consideration for overall health. I know for me, I suffered for 9 years. I was pretty much on a deathbed with a lot of things happening, multi-system failures going on, and I've been restored fully. I've worked with multiple hundreds of patients now, and reestablishing. I've got diabetics that are able now to get off their oral agents. The doctors are decreasing their insulin doses. They're getting off their cholesterol medications just because that gut biome is reestablished. So I hope this helps, and I will be back next week with one more product.